Assalamu alaikum. Our lecture in advanced biology is saliva as a diagnostic fluid. Saliva testing or Salivaomics is a diagnostic technique that involves laboratory analysis of saliva to identify markers of endocrine, immunologic, inflammatory, infectious, and other types of conditions. Saliva is a useful biological fluid for assaying steroid hormone, such as cortisol, genetic material like RNA, proteins such as enzymes and antibodies, and a variety of other substances including natural metabolites including saliva nitrite, biomarker for nitric oxide status. Saliva testing is used to screen for or diagnosis numerous conditions and disease states, include Cushing's disease, HIV, cancer, parasite, hypogonadism, and allergies. Human saliva is not just the fluid in our mouth, but it's a mirror of our body health and well-being. Biomolecules that are circulating in the blood are also found in human saliva. It consists of approximately about 2,000 proteins, and most significantly, 26% of these proteins are also found in the blood. Therefore, emphasize the saliva important as an aided biological resource for disease diagnosis and monitoring, as well as ultimate diagnostic medium to establish a person's response to treatment. The field of saliva diagnostic began in the early 1660s when salivary calcium levels were found to be elevated in disease called cystic fibrosis patients. Hence, today, in the era of nanotechnology and genomics, field of salivary diagnostic is promising a dramatic change in disease diagnosis and clinical monitoring. It has expanded into detection of cancer, heart, and infectious diseases. The advantages of saliva as a diagnostic fluid are that it is simple to be collected, convenient to store, essentially non-invasive, and contains high-quality DNA. Therefore, saliva is a perfect substitute for blood. The research in Salivaomics or saliva testing has an important role in identifying biomarkers of diseases and potential drug targets, also has the potential to diagnose disease in their early stages. However, research on Salivaomics and its application for the diagnosis of disease is still in its early stages, and the progress of these studies is limited by the lack of efficient and useful method and techniques. We need to develop a system of salivary molecular identification and standardized salivary evaluation. Systemic knowledge networks of Salivaomics and precise biomarkers of disease can contribute to a better understanding of the correlation between oral health and systemic health, which will promote the application of precision medicine by facilitating the individualization of precise, pain-free, and convenient targets therapy. As a diagnostic fluid, saliva offers distinctive advantage over serum because it can be collected non-invasively by individuals, even by patient himself. Does not require special equipment for collection and storage as unlike blood. Saliva does not clot. Advantages for person in whom blood drawing is difficult, as in obese, and hemophilic patient. Whole saliva used for diagnosis of systemic diseases because it contains serum constituents. These constituents are derived from the local vasculature of the salivary gland and gingival crevicular fluid. Further analysis of saliva may provide a cost-effective approach for the screening of large populations. Advances in the use of saliva as a diagnostic fluid have been affected by current technological development such as enzyme-linked fluorescence technique, Western blot assay, and polymerase chain reaction or PCR. The whole saliva is a mixed fluid that is derived predominantly from the major and minor salivary glands. Whole saliva also contains gingival crevicular fluid, mucosal transudate, expectorated bronchial and nasal secretion, serum and blood derivatives from oral wound, bacteria, bacterial product, viruses and fungi, desquamated epithelial cells, other cellular component, and food debris. Saliva is approximately 99% water and 1% protein and salts. Normal daily salivary flow range from 0.5 to 1.5 liter, with average volume of 1 ml at any given time. Saliva can be considered as a gland-specific saliva and may be whole saliva. Evaluation of the secretion from the individual salivary gland are primarily useful for the detection of gland-specific pathology, i.e. infection and obstruction of the salivary gland. However, whole saliva is most frequently studied when salivary analysis is used for the evaluation of systemic disorders. So the salivary flow average about, as we said, 0.5 liter to 1.5 liter per day. Unstimulated flow, resting salivary flow, no external stimuli, about 0.2 ml to 0.3 ml per minute, while stimulated flow will respond to stimulus, usually taste, chewing, or medication. Example at mealtime, about 1.5 ml to 2 ml per minute. The composition of saliva, as we said before, about 99 or to 99.5% water and 0.5 to 1% solid and protein. So this is the water, 99%, and solid, which include organic substances and inorganic substance and gases. Function of saliva for protection, buffering, tooth integrity, antimicrobial activity, tissue repair, digestion, and taste. Formation of saliva. Acinar cells produce initial saliva composed of water, ions, enzyme, and mucus. Initial saliva is isotonic and has approximately same osmolarity as plasma. Initial saliva passes from acinus to duct, first intercalated duct, then striated, then excretory duct. Ductal cells modify initial saliva to produce final saliva by alternating various electrolyte concentration. Ductal cells absorb sodium and chloride, decreasing ion concentration in saliva. Ductal cells secrete potassium and HCO3, increasing ion concentration in saliva. Salivary HCO3 neutralize oral bacterial acid, maintain dental health. Final saliva is hypotonic and has lower osmolarity than plasma. Advantage of saliva than blood. First, as we said, is non-invasive diagnostic fluid of disease and monitoring of general health. Second, painless. Patients suffer no discomfort and little anxiety in collection process than blood. Third, simple in collection with a modest trained assistant and applicable in remote area. Fourth, relatively cheap technology as compared to other tests. 5. Cost-effective applicability for screening large population. 6. Can be used to study special population where blood sampling is a problem, like children, anxious, handicapped, elderly patients. 7. Convenient for multi-sampling. 8. Safer for health professional than blood test. 9. Compared to blood and urine, saliva is also cheaper to store and ship. 10. In addition, saliva does not clot and can be manipulated more easily than a blood sample. While the limitation of saliva, first, level of certain marker in saliva are not always a reliable reflection of the level of these marker in serum. Second, salivary composition can be influenced by method of collection and degree of stimulation of salivary flow. Third, changes in salivary flow rate may affect the concentration of salivary markers and also their availability due to changes in salivary pH. Fourth, variability in salivary flow rate is expected between individuals and in the same individual under different conditions. 6. In addition, many serum markers can reach whole saliva in an unpredictable way, i.e. gingival clavicular fluid flow and through oral wounds. These parameters will affect the diagnostic and useful of many salivary constituents. 7. Furthermore, certain systemic disorder, numerous medication and radiation may affect salivary gland function and consequently the quantity and composition of saliva. Finally, whole saliva also contain a proteolytic enzyme derived from the host and from oral microorganism. This enzyme can affect the stability of certain diagnostic markers. Some molecules are also degraded during intracellular diffusion into saliva. Analysis of saliva done for the diagnosis of the following: hereditary disease, autoimmune disease, malignancy, infections, monitoring of level of hormones, and monitoring of level of drugs, bone turnover marker in saliva, forensic evidence, dental caries and periodontal disease, and diagnosis of oral disease with relevance for systemic diseases. First, hereditary disease, like cystic fibrosis, is a genetically transmitted disease of children and young adults, which is considered generalized exocraniopathy, a defective electrolyte transport in epithelial cells and viscous mucus secretion from gland and epithelia characterize this disorder. The organ mostly affected in cystic fibrosis are sweat gland, lung, and pancreas. Elevation in electrolyte like sodium, chloride, calcium, and phosphorus, urea and uric acid, total protein, and lipid were observed in the submandibular saliva of cystic fibrotic patient. Most of the studies concerning the diagnostic application of saliva for cystic fibrosis are relatively old, and saliva is not currently used for the diagnosis of this disorder. Other hereditary disease is 21-hydroxylase deficiency, is an inherited disorder of steroidogenesis which lead to congenital adrenal hyperplasia. Early morning salivary level of 17-hydroxyprogesterone determined by ELISA is an excellent screening test for the diagnosis of non-classic 21-hydroxylase deficiency since the salivary level accurately reflected serum levels of 17 OHP. The second disease is autoimmune disease, like Sjogren's syndrome. Sjogren's syndrome is an autoimmune exocriniopathy of unknown etiology. Serum chemistry can demonstrate polyclonal hypergammaglobulinemia and elevated level of rheumatoid factor, anti-nuclear antibody, anti-Sjogren's syndrome A, and anti-Sjogren's syndrome B antibody. In addition, increased concentration of sodium and chloride, IgA, IgG, lactoferrin, and albumin, and a decreased concentration of phosphate were reported in saliva of patients with Sjogren's syndrome. No single salivary or serum constituent can accurately serve as a diagnostic marker for Sjogren's syndrome. The most important aspect of salivary diagnosis for this disease is the reduced salivary flow, or xerostomia. Although not pathognomonic for Sjogren's syndrome, is of clinical importance and can lead to a variety of oral signs and symptoms, such as progressive dental caries, fungal infection, oral pain, and dysphagia. Dentists are normally the first to encounter these patients. Affected individuals should be referred for the comprehensive evaluation of the cause for the reduced salivary flow. Third, malignancy. Salivary analysis may aid in the early detection and screening of certain malignant tumors. Saliva also aids in monitoring the efficacy of treatment. The messenger RNA level for specific protein are elevated in the saliva of head and neck cancer patients. P53 is a tumor suppressor protein which is produced in the cell exposed to various types of DNA damaging stress. Inactivation of this suppressor through mutation is considered a frequent occurrence in the development of the human cancer. Accumulation of inactive P53 protein occurs, which in turn lead to the production of antibodies directed against this P52 protein. The P53 antibodies can be detected in the saliva of patients diagnosed with the oral squamous cell carcinoma and can thus assist in the early detection and screening for this tumor. Defensine. Elevated level of salivary defensine 1 were found to be indicative of the presence of oral squamous cell carcinoma. High positive correlation was observed between salivary defensine 1 level and serum level of squamous cell carcinoma related antigen. CA-125 is a tumor marker for cancer. Elevated salivary level of CA-125 were detected in patients with untreated breast cancer than healthy controls, and patients who were treated for breast cancer. A positive correlation was found between salivary and serum level of CA-125. Another condition is infectious diseases. Saliva contain immunoglobulin like IgA, IgM, IgG that originate from two sources, from the salivary gland and from serum. Antibodies against viruses, bacteria, fungal, and parasite can be detected in saliva and can aid in the diagnosis of infections. Helicobacter pylori infection has been associated with peptic ulcer and chronic gastritis. Oral cavity may be the source of infection. There was considerable variation in the detection of the rate of Helicobacter pylori DNA in salivary samples. Shigella is the children infected with Shigella revealed higher titer of anti-Shigella toxin antibody in comparison with healthy control patient. Pneumococcal pneumonia, the detection of pneumococcal polysaccharide in saliva by ELISA technique may offer a valuable complement to conventional diagnostic method for pneumococcal pneumonia. Non-invasive diagnosis of amoebic liver abscess is challenging. Detection of Escherichia histolytica DNA in saliva by real-time PCR assay could be used as a diagnostic. Viral diseases like HIV antibody to HIV in whole saliva of infected individual was detected by ELISA and Western blot assay, correlated with serum antibody level. Salivary IgA level to HIV decline as infected patients become symptomatic. It was suggested that detection of IgA antibody to HIV virus in saliva may therefore be a prognostic indicator for the progression of HIV infection. Analysis of antibody in saliva as diagnostic test for HIV or other infections offer several distinctive advantages when compared with serum. First, saliva can be collected non-invasively, as we said, which eliminates the risk of infection for the healthcare worker who collect the blood sample. Second, furthermore, viral transmission via saliva is unlikely since infectious virus is rarely isolated from saliva. Third, saliva collection also simplifies the diagnostic process in a special population in whom blood drawing is difficult, like individuals with compromised venous access, example, injecting drug users, patient with hemophilia, and in children patient. Hepatitis. Saliva was found to be a useful alternative to serum for the diagnosis of viral hepatitis. Acute hepatitis A and hepatitis B were diagnosed based on the presence of IgM antibodies in saliva. Hepatitis B virus DNA revealed by PCR in saliva. Quantitative detection of DNA used to evaluate level of virus in the body copy for judgment of infection. It also points to the possible role of saliva as a source of HB virus infection. Saliva has also been used for screening for hepatitis B surface antigen in epidemiological studies. Measles, mumps, and rubella, also viral diseases. Saliva may also be used for determining immunization and detecting infections with measles, mumps, and rubella. Reactivation of herpes simplex virus type 1 is involved in the pathogenesis of Bell's palsy, and PCR-based identification of virus DNA in saliva is a useful method for early detection of HSV1 reactivation in patients with Bell's palsy. Dengue is a mosquito-transmitted viral disease. Salivary level of anti-dengue IgM and IgG demonstrated sensitivity of 92% and specificity of 100% in the diagnosis of infection. So detection of dengue-specific salivary IgG and IgM antibodies is useful markers for dengue infection. Detection of drugs. Saliva has been proposed for the monitoring of systemic level of drugs. A fundamental prerequisite for this diagnostic application of saliva is a definable relationship between the concentration of the therapeutic drug in blood and the concentration in saliva. Only abundant fraction of the drug in serum is available for diffusion into saliva. The abundant fraction of the drug is usually the pharmacologically active fraction. This may represent an advantage of drug monitoring in saliva in comparison with that in serum, where both bound and unbound fraction of the drug can be detected in saliva. A drug monitoring in saliva, these are the drug that is monitoring in saliva, like antipyrine, phenylclidine, and carbamazepine, and etc. Saliva may be used for the monitoring patient compliance with psychiatric medication. Saliva is also useful for the monitoring of anti-epileptic drug and anti-cancer drug. Estimation of salivary carbamazepine level is a predictable and convenient method of drug monitoring in epileptic patients. Of particular interest is the use of saliva for the evaluation of illicit drug use. Following drug use, the appearance of drug in saliva follow a time course that is similar to that in serum. The presence of illicit drug and not their concentration is usually sufficient for forensic purposes. Ethanol. Salivary ethanol concentration may be used as an index of the blood ethanol concentration, provided that the salivary sample is obtained at least 20 minutes following ingestion. Nicotine. Saliva can be used to monitor tobacco smoking and exposure to tobacco smoke. The major nicotine metabolite, cotinine, was investigated as an indicator of exposure to tobacco smoking. Cotinine is tobacco specific and has a relatively long half-life, about 17 hours. Compared with nicotine, salivary cotinine levels were found to be indicative of active and passive smoking. Also, the monitoring of hormone level in saliva. Saliva can be analyzed as part of the evaluation of endocrine function. Cortisol. A steroid hormone can be detected in saliva. Salivary cortisol levels were found to be useful in identifying patients with Cushing syndrome, Addison disease, and the effect of stress. Aldosterone. Recent evidence demonstrates an increased incidence of primary aldosteronism is approximately 10% of the hypertensive population, making non-invasive and simple screening method necessary. Salivary aldosterone correlates significantly to plasma aldosterone level. and increased aldosterone level were found in both the serum and saliva of patients with primary aldosteronism, or called Cone syndrome. Testosterone hormone have also been identified in saliva. Correlation between the salivary testosterone concentration and the serum-free testosterone concentration is better than with total serum testosterone, because most of the testosterone hormone in the saliva is in the free form. Progesterone hormone. Salivary progesterone level shown good correlation with the free serum level. Elevated salivary progesterone is associated with increased risk of a preterm birth. Insulin. Insulin can be detected in saliva. A positive correlation between saliva and serum insulin level following a glucose tolerance test was reported for healthy subjects, diabetic patients, but the use of the salivary insulin level for the evaluation of serum insulin level could be misleading, since a significant discrepancies between the salivary and serum insulin level were detected for several individuals. Additional studies are required to determine if salivary insulin level should be used for the evaluation of serum insulin levels. Saliva also contains multiple components whose concentration are altered by diabetes, some of which, glucose, alpha amylase, and ghrelin, have strong diagnostic potential. In general, serum and salivary level of protein hormones are not well correlated. These hormones are too large to reach saliva by means of passive diffusion across cells or by ultrafiltration, and the detection of these hormones in saliva is primarily due to the contamination from serum through gingival clavicular fluid or oral wounds. Protein hormones such as gonadotropins, prolactin, and thyrotropin cannot be accurately monitored by means of salivary analysis. Bone turnover marker in saliva. Saliva can be used to measure bone turnover marker. Commercially available ELISA used to test for the presence of osteocalcin and pyridinoline in the whole human saliva of women. Level of osteocalcin and pyridinoline in saliva correlated reasonably well with bone mineral density scores, suggesting that saliva may be a valuable tool for assessing human markers of bone turnover. Further further research is necessary to determine whether salivary level of bone turnover marker correlate with serum. Forensic evidence. Saliva may be found on victims of several violent crimes. Saliva can potentially be recovered from bite marks, cigarette butts, postage stamp, envelopes, and other objects. Stains of dried saliva are invisible, making its recognition and collection difficult. However, the presence of saliva can be confirmed by amylase assay. During the biting process, saliva is deposited on the skin or object surface in enough amount to allow typing of the DNA. Polymerase chain reaction allows replication of thousands of copies of a specific DNA sequence in vitro, enabling the study of a small amount of DNA in saliva. Dental caries and periodontal disease. Numerous studies have aimed at finding a correlation between dental caries and saliva constituents, with only weak correlations. High bacterial aggregation activity of saliva has been associated with low caries experience, since there is a long list of salivary proteins that bind and aggregate oral bacteria. So aggregation couldn't be correlated with a specific salivary proteins. Several bacteria have been associated with periodontal disease. These bacteria are susceptible to different antibodies. Therefore, prior to antibiotic treatment, pathogens should be determined by culturing or PCR technique. Oral fluid may be used for that, or small methylcellulose paper strip can be used to collect fluid from gingival crevice. Nevertheless, the recent focus on the potential role of periodontal disease as a risk factor for cardiovascular and cerebrovascular disease bring new importance to this aspect of salivary analysis. Diagnosis of oral disease with relevance for systemic disease. Some systemic disease affects salivary gland directly or indirectly and may influence the quantity and quality of saliva. These characteristic changes may contribute to the diagnosis and early detection of these disease. Qualitative changes in the salivary composition can also provide diagnostic information concerning oral problem. Increased level of albumin in whole saliva were detected in patients who receive chemotherapy and subsequently develop stomatitis. Monitoring of salivary albumin can assist in identification of stomatitis at a preclinical stage and enable the treatment for the stomatitis to be initiated at any early stage. Similarly, epidermal growth factor in saliva is decreased during the course of radiotherapy, and severity of mucositis related to reduce of epidermal growth factor concentration in saliva. These are the systemic disease affecting salivary gland and saliva, like Sjogren's syndrome, rheumatoid disease, and etc. There are variables that contribute to within person and between person variances in cortisol level during saliva testing. The most important one is diurnal variation. Is a major factor for within person variance because baseline cortisol level have been known to differ based on the time of the day. For normally developing individuals who follow a typical day-night schedule, cortisol production peak during the last few hours of sleep. This peak is thought to aid in preparing the body for action and stimulate the appetite upon waking. Diurnal variation is also affected by psychological condition. For example, early morning cortisol levels have been found to be elevated in shy children and late night level elevated in depressed adolescent, particularly between the hours of 2 and 4 p.m. This might be important for understanding emotions and depressive symptoms. Other variables that affect within and between person variation are age. Age is one of the major factors for between person variance. Some studies indicate children and adolescents exhibit a greater cortisol activity potentially related to development. Gender has been found to impact baseline level of cortisol, contributing to between-person variance. In generally, stressful situation level of cortisol in male have been found to increase to nearly double the amount when compared to female. The menstrual cycle has been found to impact level of cortisol in the body, impacting both within and between person variance. Women in the luteal phase reportedly have a level of cortisol equal to men, suggesting no sex differences in base level of cortisol when women are not ovulating. Women in the follicular phase and women taking oral contraceptive reportedly have significantly lower level of cortisol when compared to men and women in the luteal phase. Pregnancy has been found to increase level of cortisol in the body. In particular, breastfeeding has been found to decrease level of cortisol in the short term, even if the mother is exposed to the psychosocial stressor. Nicotine is known to increase level of cortisol in the body since it stimulates the HPA axis. After at least 2 cigarettes, smokers show significant elevation of salivary cortisol level. Furthermore, habitual smokers show blunted salivary cortisol response to psychological stressor. Food has been found to affect level of cortisol. The presence of protein has been found to increase cortisol. This variable is often affected by diurnal variation, with cortisol being notably higher during lunchtime than dinner time, and gender, with women having higher level of cortisol effect of alcohol consumption and caffeine intake on base level of cortisol have found positive correlation. The results are mixed and won't benefit from further examination. Intense and prolonged exercise can result in increased level of cortisol. Short-term and low-level exercising only mildly increased level of cortisol. Repeated exposure to initially stressful stimuli has been found to result in a leveling of cortisol in the body. Birth weight has been shown to be inversely related to base level of cortisol. Low birth weight is correlated with high level of cortisol. Some medication, i.e. glucocorticoid, steroid, psychoactive drug and antidepressant drug have been found to affect level of cortisol in body, but the result from study examining these effects have been mixed. The impact of medication on the cortisol level could benefit from further research. That's all for this lecture. Thank you for listening.